third world country compares to the first world. And there's some things that they do very well. So if you think about what you need to have a good healthcare system, you need well-educated doctors, nurses, you need resources, and you need good administration. And the orthopaedic ward had one. So it's starting. So they've got well-trained doctors. So there's no actual in-house training over there, so everyone's got to go offshore for specialty training. But Australia supports them very well with that, and there is actually, currently at the moment, there's 3 registrars in training that are training through like a Pacific Island regional type thing, and they're doing their specialty training in orthopaedics. So that program's been up and running for a while now, and I guess the more well-qualified people they have, the better quality care. If you think from a resources perspective, orthopaedic patients are generally pretty healthy, barring their injury, and so they usually get out pretty quickly. But when you don't have mobility aids and you don't have, there's not a wheelchair in the whole hospital, and so any sort of spinal cord injuries, which they don't have a neurological department, so that's all orthopaedics as well, they just unfortunately languish in the hospital, and that's where they're let down. They don't have the resources to do that.
There were very common sort of things that people got done. So amputations were incredibly common. So most of the amputations were secondary to type 2 diabetes. So they do have a lot of problems with diabetes over there. And it gets to the stage, and I'll sort of talk about it a little bit later on, but they always present quite late to the hospital. So it gets to the point where either they need a serious debridement of a wound that's sort of gone gangrenous, or they need an amputation from small vessel disease, and it's just caused a huge ulceration and it's become gangrenous. Radical mastectomies, which I was quite shocked about. Almost all of the female ward was radical mastectomies and thyroidectomies. Papillary carcinoma seems to be particularly prevalent over there. I'm not sure why that is.
It's a beautiful place. It's a great place for a holiday. So we did some awesome scuba diving over there. Some beautiful beaches for swimming on. Some waterfalls down the bottom right. We were climbing through jungles and waterfalls there. And on the back of one of our friends' boats, we got to do a bit of tubing. Beautiful islands. This is Fat Boys Resort, which I'll do a little bit of promotion for if you're ever going to go over there. Stay at Fat Boys. We had a great time there. This is us in front of the hospital, and this is us giving the medical supplies we brought over. So I'll get back to Nick to talk about the supplies we took over there.